Are you based in Seattle and in Africa, or mainly based in Seattle and doing field trips for each missions and each project?
Seattle, and pre-COVID, a lot of field trips. I was in Africa about every 6 weeks.
So another reason and another way to monitor project, therefore.
Yeah. And I've also lived in Ghana and in Mali. My last trip was Tanzania. I've spent a lot of time in Tanzania with the health system there. So hi, Ali.
So I'm not sure, Ali, can you hear us? I'm not sure you can hear us now.
Yeah, I think it's still having problems. It's unfortunate. I think we can probably start in 2 minutes, I'll say, because I'm still waiting on one guest to show up.
Diego, I'm getting a feedback when...
Okay, there's a feed. Okay, let me see if I can adjust my sound here. Not sure what the problem is.
It's just when you speak. I don't get it when Virginie speaks.
Is it better now? No?
If you can hear me, I think you also just get a head start, and I'll do it.
Yes. Okay, we can hear you, Ali.
Virginie, are you getting that kind of feedbacky sound when people speak?
I don't.
Might be the platform. I don't think I have any.
Now it's better again.
No, it's better. Yeah.
I see Ali is saying that everybody sounds strange on his end too.
Okay.
For me, it's perfect. But,
okay. And when you're speaking, it's fine. That's interesting. Like even when I speak, it's like a feedback thing.
So should we start, and so people can join us,
yes,
or do you want to wait for a couple of minutes?
I think we can go ahead and start. Our guest from Ghana probably going to join us later on. Oh, there he is.
There you go.
How are you doing?
Good afternoon.
Hi, sorry, I'm a bit late. We had another session that I needed to quickly run away from. Sorry.
Okay, no problem. So we have everybody. I think everybody can hear it fine. Don't have any issues. We're going to go ahead and start. This is the second webinar in a series of many brought to you by afaih, African Forum of Artificial Intelligence for Health. In the next couple of weeks, the afaih webinar series will be the focal point of AI as experts discuss different topics on artificial intelligence, education, and health in the developing world context. This series of webinars will be recorded and will be accessible online on the website www.afaih.com. This particular webinar is being streamed live on Facebook, YouTube, and LinkedIn. My name is Diego Takizala. I'm your moderator today for this webinar. We'll be talking about mobilizing AI and data science to understand and support gender-inclusive COVID-19 action. As you might know, the 2030 Agenda for Sustainable Development recognizes the potential of digital technologies in accelerating progress in supporting the development of inclusive knowledge society based on human rights, the achievement of gender equality and empowerment. The ongoing pandemic has caused more challenges to achieve these goals as more women and other vulnerable groups are further being left behind. Understanding how the use of gender desegregated data and AI can have an impact on reversing the trend will be the focus of today's discussion. afaih has put a great panel of experts in the field of social entrepreneurship, community development, data science, and artificial intelligence. Our webinar today In our webinar today, we are honored to speak with Mrs. KIRSTEN GAGNAIRE, Mr. Ali Salim Jr., Mrs. Virginie Martin de NOBREGA, and Mr. Darlington Akogo. Mrs. KIRSTEN GAGNAIRE is CEO of the KATI Collective, an international business, and she is an international business graduate of Seattle University. Mr. Ali Salim Jr. is the founder and CEO of Inspired Idea. He has a degree in software engineering from Florida Institute of Technology. Mrs. Virginie Martins de NOBREGA is an international consultant, lawyer, and mediator. She holds an executive MBA in management of international organization from SBA Bocconi University. Mr. Darlington Akogo is an engineer and founder of Minor Health AI Labs. Welcome all to our webinar, and thank you for your time.
Thank you for having us.
All right. Before we begin, I would like you to present yourself to the audience. Tell us what you do, what kind of project are you working on, so we can have a better idea of your expertise, if you don't mind. Mr. GAGNAIRE, I don't know if you would like to start.
Sure. So at KATI Collective, we focus on projects that have to do with putting women and girls kind of at the center of development. And we focus on digital and data and also on partnerships. So a couple of things that we're working on right now. We're working with the Bill and Melinda Gates Foundation.
Okay, we lost Mr. GAGNAIRE. Mrs. Virginie, if you want, you can go ahead and start. And when she comes back, she's going to present herself again.
Yes, thank you. So good afternoon, everyone. So my name is Virginia. I'm based in Brussels and Paris, and I'm advocating for the last 2 years for AI, responsible AI, ethical AI, and AI for good. So my research was conducted back in 2018 to really look at the international governance of AI with a strong focus on the United Nations system and ecosystem through the Innovation Lab for Sustainable Development Goals. And I'm also a board member of a not-for-profit specialized in gender and trying to empower economically and socially women through the career. And so during the COVID, I have joined courses as an expert in AI and in public policies to develop a mapping of the evolution of the crisis and how it did impact women through gender-based violence, but also through a lack of access to financial resources.
Very good. Interesting. Mr. Salim Jr., you want to present yourself to the audience? Introduce yourself to the audience.
Hi, everyone. First of all, I'm really happy I'm not the only one with internet problems. It seems to be a universal thing that unites us all, which is cool. But I work in software engineering. My background is in software engineering and mathematics, and we work in Tanzania building health tools for healthcare workers in rural areas. We're trying to make sure we give our healthcare workers superpowers. That's the plan.
Great. Mr. Akogo?
Yeah, hello. I'm Darlington Akogo, the founder and director of Minor Health AI Labs. So we develop AI for health solutions and also participate in AI for health research. So work on a number of stuff in infectious diseases, but also non-communicable diseases using AI-based solutions in radiology. I know Ali and Frank because we are part of focus group on AI for health and World Health Organization, and then ITU. So I'm the topic group of AI and radiology lead, or in that context, topic driver. So yeah, working on regulations and standards to guide the development, use, and then assessment of AI solutions in radiology.
You are muted, Diego, so we can't hear you.
Yeah.
There you go. Can you hear me now?
Yeah.
Okay, great. All right, thanks a lot for introducing yourselves to the audience. I'm going to ask you a series of questions. You can answer them collectively. So these questions are not addressed to anybody in particular. I'd like you to work as a team and try to answer my question the best way you can. You're also allowed to comment on other panelists' responses. So the first question we prepared for you today was, as you know, organizations around the world spend millions of dollars on collecting and analyzing data. How can this data be used in actionable and profitable ways? Can you give us some example of how you're using data in your organization to make impactful decisions?
Like to start.
Yes, anybody can
Okay.
start, and
Okay.
other people will join.
Okay, sure. Then I'll give it a shot.
Okay.
Yeah. So so as far as healthcare specifically, we work with a number of facilities in Ghana. That's where we get our data, and then that's what we've been building systems on. But even if we make this specific to COVID-19, we started a while ago with a dashboard that collected data from across Africa and then made some analysis purely on the African context. So there was like John Hopkins University's dashboard and a number of dashboards internationally. But then Africa as a content, somewhere around March, we did not have any specific dashboard. We had countries having their own dashboard, but then if you wanted to know the total number of people that were affected by COVID-19 in Africa, there wasn't anything like that. So we did that. We also did a lot of log scale analysis. Then we went from that to predictive modeling. As far as COVID-19 in Africa, we engaged a number of stakeholders on this. Yeah, so those are all part of things we've been doing. Even more specifically, malaria is a huge problem in a lot of places in Western and then Eastern Africa. So we did a project with West African Center for Cell Biology of Infectious Pathogens. What we did was we collected protein-based data as far as people with immunity to malaria. So those who have high immunity and those who have low immunity in Ghanaian communities. And then we used machine learning to be able to study this to identify what was responsible for high immunity compared to lower immunity. And the goal of this is to help towards developing more effective vaccines towards malaria. So yeah, we've done a number of things. Literally everything we do is on the basis of collecting data and then either analyzing that data or using that data to build AI systems.
Very, very interesting. Now, after you collect the data, are you able to share the data with other organizations that might need the data for their projects, or or are you guys pretty much working in silos?
Yeah, that's usually on a context-to-context basis. There are certain data that, yes, we do share, or it's easy to share, and there are certain data that we cannot share. It's more sensitive. So if you are collecting medical images, x-rays of patients, right? Even some facilities, there are facilities that will not even be able to share that data with us. And then the few that we come into that trust agreement and they share that data with us, we cannot open it up. But then there are other scenarios where you can fully open up the data. So it's a context and then a case-by-case basis sort of affair.
Very interesting.
Thank you for that. It's interesting, and indeed, I think during COVID and crisis in general, we see current systemic inequalities being increased and highlighted, and pandemic certainly didn't lie about that. And over, the course of the last 5 years and 10 years through the disaster management cycle, we have seen that gender is key in addressing the crisis, because women, but also vulnerable people, indigenous people, are the most affected by the crisis, whether in early warning mechanism, during the crisis, and after that. And I would say that for women, everything that has been developed by AI, Health AI, is interesting. First, to map out where are the inequalities, how women are impacted by the different measures, and how the number of cases do rise according to the region, but also to gender. And for that, we need disaggregated data, which is lacking yet. If you look at the WHO data for now, we have seen that only 40% of the cases that were reporting during COVID were related to disaggregated data. So to that stage, we just can analyze 40% of those data related to women. What would be also interesting beyond mapping a region would be also to adapt the agent modeling pattern to women and children, to really see how they behave before the crisis, during the crisis, how much can they access health facilities, where do they go in terms of when the crisis is happening, and therefore try to develop a mechanism where they can access information, where they can access health facilities. Because for women, we have also seen that sometimes during the crisis, are not able to have that much mobility compared to men. They don't have access to the critical information that they need to have access to basic health services, but also more sophisticated health services. And I think AI can support that. But as Darlington was saying, I think it's also a question, what is your framework of collecting data? What is your framework of analyzing data, and what is your framework of disseminating the data? And what kind of information are you looking at? Because we have also seen a lot of fragmentation in the market of data, I would say, during the COVID. So everyone is running a hackathon in the region for a niche market, for a specific targeted population, but how do we centralize that regionally, nationally, at an African level? So therefore, this data can be used during the COVID and after the COVID to improve public policies, to improve the services, and not to overcompensate a lack of investment in basic infrastructure when it relates to health, which remains a strategic sector for African countries and everyone in general. So that's what I have witnessed through my experience of the pandemic.
All right, that's some very good feedback. I don't know if any of the panelists would like to add to the comments just heard.
I would try and approach it from the other way, just to offer an alternative. But first, I think Dr. KIRSTEN was doing her introduction when she was called.
Thank you. I'm sorry.
Right at the exciting
it was
part.
a terrible time for my computer to crash, but it has rebooted. Yeah, I'll just quickly tell you a little bit about my work, and then I'm happy to join back into the conversation. So as I mentioned, we've been doing some work with an alliance of vaccine delivery folks globally, and looking at developing an action plan for supporting the Immunization Agenda 2030 and the data components of that. And it's a global action plan of prioritizing what needs to be invested in terms of data collection and use and analysis to support the immunization agenda for the next 10 years. We're also doing some work with Malaria No More, which is a malaria advocacy organization, and we've been looking at the intersection of gender and malaria and the ways in which girls and women are disproportionately impacted by malaria, and also as change agents have an opportunity to help impact the eradication and elimination of malaria. And then finally, I also do quite a bit of work with the Global Financing Facility and working with countries such as Tanzania and Malawi on everything from development of their investment cases to developing their monitoring and evaluation strategies. So.
Very impressive. Very good. Nice introduction. Mr. Ali, I think you wanted to add to the comments of Ms. Virginie and Mr. Akogo.
Yeah. I I agree with what the previous speakers have said, and I think it's absolutely true, all of it. But looking at it from a perspective of Tanzania, where if we look at COVID specifically, we've stopped sharing data months ago, and we are COVID free. But yeah, so it gets really hard to collect data that we're not tracking anymore, which is interesting. And this is in no way a political statement or any of that. It's just harder to track something that you're not measuring. So from our perspective, we use expert knowledge. So we are Bayesian all the way. So we take a lot of prior information into our modeling and our decision making process. We add that to the very little data that we have, and as we all know, data is a big problem. Finding the data that you need rarely, if ever, happens. Finding it with all the variables that you need is even more unlikely to happen. So we kind of take the middle ground between data and expert knowledge. With expert knowledge, we model it into either a directed acyclic graph or some sort of generative process, and then we expose that process to the data that is available, given that it's from different sources and whatnot, and we can use this to make simulations or to improve decision making.
All right, very interesting. I know, Mrs. Garner, you missed the first question, so you probably don't quite understand what they're talking about. The first question was relating to data. We were trying to figure out how organizations use data in impactful ways. Can you share maybe some examples in your particular organization, how you use data in the past to make impactful decisions?
Yeah, I think, one of the things that we see frequently, especially in my work, working directly with ministries of health, is that it is important to have data, but just from the gendered impact side of it, data is often not sex and age disaggregated. So we often don't know what the health impacts are on women, but also on adolescent girls. And that's where the age disaggregation is particularly important. And that information is critical, especially now during COVID, of understanding not only the impacts of COVID differently for men and women and for different age groups, but also as we're looking at basic healthcare systems and the inability of people to access those services, things like antenatal care, newborn care, birthing services, family planning services, and things like that. And again, we expect that women and girls are probably disproportionately impacted in this. But if we don't have the data to tell us that, then we can't adjust accordingly. So I would say that having that kind of appropriate data at the facility level that gets rolled up to the national and the global levels is really critical.
Very good. Now, since we're speaking about COVID, obviously COVID has pretty much turned the world upside down. How do you guys think data science, digital and innovation, maybe in combination with other practices, can have a differential impact on gender inequalities when it comes to dealing with the ongoing COVID situation? Because obviously a lot of people have lost jobs due to COVID, and I'm not sure if anybody's tracking. I mean, women are impacted by the loss of jobs. And also, some researchers discovered that male are more prone to catch COVID, the coronavirus. But somehow the data is not reflecting any of that because, again, the data is not desegregated. So in the midst of all of that, how do you guys think we can use data science, maybe artificial intelligence, or any type of digital innovation to make sense of what's going on now and to have a clear understanding of how the different genders and the different segments of society are affected by the pandemic?
Yes, I can go. So I think we already have some disaggregated data, but I think it's very specific to some threats to women. So we had a lot of information through for gender balance for gender-based violence, sorry, where a lot of organizations, yes, we did UN Women to try to have both data. We have also tried to monitor in the project I was involved in how the women were impacting in the job, how many women did lose the job, and how trying to access the information related to how many women, depending on the community, were working in informal economy. So then it's a question to try to gather all this information, to evaluate and give meanings to this information. And also, I think the true innovation is not to see AI as a magic wand that will solve everything related to data, but the true innovation will be to use AI as a mean to support everything that has been already done through the different grassroots organizations, through the basic pillars of development, meaning infrastructure, education, and the health sector. And when you use that, I think AI especially, sorry, I think there is a lot of AI application now that can access those remote population, which is being women or also girls or also indigenous people. So we already have in Tanzania, in Uganda, and in other countries, SMEs-related platform where you can have a dissemination of information, critical information related to the crisis. So what you should know about the pandemic, where to go, and those things can be enhanced if you have natural language processing platform where all the ethnic languages can be automatically translated. So you have the main information in English, and then you reach out to the different communities in their own language through this platform, which would be great because again, both communities sometimes are very remote and they don't have access to English, for example. You also have gaming, but it's much more on the early warning system or afterwards how to train women to understand how the health sector works and where to go if they need that. And also something I think should be more developed when we talk about having access to basic health system and more sophisticated services, is to have those similar programs that we do in the system, which is cash for health, meaning that the family of the community receive cash if the woman has access to certain program or certain treatment, and therefore it's not even an option, and she's not lacking the financial resources because she's going to the hospital. And drone surgery is something of e-clinic, as we call them, to make diagnostic remotely for as long as they have access to the internet, which is always a problem also in African developing countries, would be of great added value. But again, it's just, I would say, the sharing of the top, it shouldn't undermine the fact that government and grassroots organizations need to be very strategic in investing much more in the health sector and the infrastructure to provide health services to both remote population.
Yeah, that's some very good feedback. I'm not sure if anybody else want to add to what Virginie just said. Any thoughts?
Well, I'll just add to answer part of your question. I think there was a few questions in there, and one of the things that I heard you asking, Diego, was about ways that data science and AI and digital can help with people during the pandemic. And I think one of the real upsides is being able to connect people to services. Again, for women, and Virginie mentioned gender-based violence, digital and technology is a way to reach women who might otherwise be isolated and to be able to connect them to critical services and information. But also it's an important way to combat disinformation. Turn.io, which is a platform out of South Africa, has done just amazing work with being able to very quickly roll out an AI-based, WhatsApp-based service in many countries around the world that is coming from the ministries of health and is meant to combat disinformation and rumors and give people factual health information and factual information about what they can do to protect themselves, what the signs and symptoms are, and what they need to do to seek care. So I think those are some of the real upsides to data science and AI that we're seeing right now.
Very good. All right, we'll continue with the next questions. How can data science, digital, and innovation in combination with other practices understand? I'm sorry, I already asked you that question. So the next question is, what data science innovation approaches and techniques can be leveraged to help meet the immediate needs of women and other vulnerable groups such as migrant and indigenous communities during the pandemic?
We can give our African colleagues an opportunity to answer. I don't know if Ali or Darlington have a comment or how you're maybe seeing it in your communities.
Yeah, I think this question is very similar to the first question. And so most of the answers that were given will probably cover this question as well. But then probably the only thing I'll add to it is that now more than ever, everyone in their own sense are data scientists and data analysts. Most of us have not necessarily lived through this pandemic and then the last one, which was the Spanish flu. So we take for granted certain things like on daily basis, just your average citizen of any country looking at some portal and checking how many cases currently are in the country. And this is almost like a daily conversation around the world. We have that power of data. You can even know in your very community how much cases are. That's a powerful scenario right there. But then going a step further, there are a lot of questions that can be answered by data science. So you highlighted the biology side where actually it says that most men are likely to die from COVID-19. It's still too early to tell, because but then in America, for example, most of the death recorded, just about like a 10% difference were men. There are sort of theories around this, some related to chromosomes, and just behavioral patterns that in some countries, men usually smoke more than women, and smoking doesn't really give you a good chance of fighting against COVID-19 once you've been infected. But there are a lot of biological questions that need to be answered with data. There's a lot of debates that is ongoing about hydrochloroquine and its combination with other medications, how effective it is. This, to a lot of degree, is also being answered by data and data analysis. Clinical trials, you have to analyze this data. You have to be able to isolate false patterns within data. So you've all had the debate of people saying that, hey, or doctors saying they gave hydrochloroquine to patients and then they recovered, and others saying it's not true, it's false correlations and all that. More than ever, data science is important in answering these questions. That is it possible that we know that people recover from COVID-19 usually in most of the cases even without any medication or just with painkillers. So in that scenario, if you give someone some medication, is it easy to conclude that that medication worked when that is not the case? But also being able to map the current infected regions, how the virus got in those regions, and predict where they are going to, we can be able to see how it affects vulnerable communities. For me personally, that is one thing I'm very excited about. I'm glad we are having the opportunity to participate in this. I'm hoping that the world moves towards that direction, even beyond COVID-19, which is that we make evidence-based decisions. If a country wants to open up schools, so Ghana, for example, say, let's open up schools. We can't let kids stay in-house for too long. There are examinations. Rather than take those decisions on your own, you should be able to run models and look at vulnerable communities that are in rural areas. If you allow them to all come to schools where there's high overpopulation in these schools, what does it do to the vulnerable communities? How does it impact them? You should run models on this before you take these decisions. And this should affect decisions on the national level, intercontinental, and even regional level. So yeah, that is something that I think is very important a need that has emerged out of COVID-19.
Yeah, and I'd just like to add on to that. I think it's it's a very challenging position to be in that our leaders are in right now, and they have to weigh all these options. And these communities already they already have disproportionate access to. One thing that I think our government is doing very well right now, educational material, which is which is really cool. It came a little bit late, but better late than never. That was really good. And the other thing I would add to this is a warning, rather, for data scientists, or rather for myself, is that we tend to play in other people's backyards too much without consulting them. So there is a lot of models out there that are doing simulations, and you look at the developers with whom we're messing around in their backyard. So warning data scientists, including my people yourself, let's add some expert knowledge in it.
Yeah, I'll just add on a little bit to what Darlington said about the importance of using data science. And I know there's a lot of interesting work that's happening with using GIS mapping and cell phone tower data of where people are migrating to. And especially with the spread of COVID, it's a great way to figure out where outbreaks are for COVID or other kinds of diseases as well, and to then be able to know where you need to focus resources. So that can be particularly helpful. I think a lot of this work will also be really critical as we look at rolling out a global vaccine. The logistics of that will be kind of overwhelming for most health systems to be able to do. And I think it will be incredibly important to know exactly who's been vaccinated, if it is a vaccine that's going to require more than one dose, to be able to reach people to get their booster dose, and to know who needs it and who's had it. So it'll be very important that we be able to collect that kind of data and be able to analyze it as we roll out a vaccine as well.
Yeah. So can I quickly wait?
Yeah, go ahead.
I know I went on endlessly, but I just remembered one point that I wanted to add to it, which was that so there's an interesting thing that is going on. COVID-19 is not spreading in Africa the same way it's spreading in other parts of the world. We've done a lot of log scale analysis and a lot of analysis comparing African countries to other parts of the world. When you plot it, you can clearly see a huge difference between how COVID-19 spreads in Africa and how it's spreading in other places. Then if you go a step further, in a lot of African countries, there are more mild cases than there are critical cases. And that ratio is also vastly different in Africa than other parts of the world. One thing that would be interesting is using data science and combining it with the biomedical science to truly understand what is responsible for why COVID-19 is having or it's spreading differently in Africa than other places. The data points to that, but that's a question to be answered. Some say it's exposure to a lot of pathogens over the years, so you've built up a stronger immune system, and even though you do not have immunity to a novel virus, generally you have a stronger immune system. It's a theory. It would be nice to combine data science and medical science to answer this question.
Yeah, very good inputs. Now, as far as the infrastructure is concerned, because we know gathering data is first of all, it's expensive. We also know that accessing the data, it's often difficult. Where would you gauge the current infrastructure in your respective countries, Ghana, Tanzania, as far as the ability of collecting data and sharing the data with all the parties involved in trying to improve health in your respective country? Do you think we're there, or do you think we still need some work when it comes to having a robust infrastructure to gather data and analyze it for different projects? healthcare, education, you name it?
From Tanzania's perspective, and by no way am I the spokesperson of Tanzania, but we have a very strong leader, and if he wills it, the data will be collected, and we do have the infrastructure to support such a will. We have a very care workers, and we can absolutely collect that data if it's a priority to the country during the decision-making time.
Okay. Now, is this data primarily collected through surveys or other means?
It would have to be a mix of both. At least from what I've experienced so far, there is the Mkapa Foundation, started, of course, by the late President Mkapa of Tanzania. And what they did is they trained a lot of community healthcare workers and unleashed them upon their citizens. And they did surveys, they did symptom assessment in the streets, which was really, really awesome and great work, actually. And then there's been a mixed reaction to this current pandemic, where some patients wait until their situation gets critical before they go to the health facility, while others go there with any sign of any respiratory tract problem. They will be there first thing in the morning, and you will see them in line. So we would, of course, need to use both methods of people who are also at the health facility, but we have the means to do both.
Yeah. Very good.
Easily
Mr.
on that.
Is it any different in Ghana, or is it pretty much similar to Tanzania?
So I would say it's a mixed situation. There are certain data that we've done a good job in collecting. Then there are other data that, just based on infrastructure, we've not been quite successful with. So if you were looking at digital health, for example, the government about 4 years ago started the initiative of medical data being collected from across the country, but then it's been successful in certain senses, but it hasn't really been successful in other senses. So what I would say is that the data culture in Ghana still needs a lot of work. So we've engaged a lot of facilities, and the data that they've actually had stored somewhere is very minimal. And that has been an issue that is reflected if you want to do a lot of statistical analysis or do a lot of modeling for COVID-19, and you are not certain about the medical capacity in a very detailed and rich sense. It affects the results that you end up with. So that has definitely been an issue. With our COVID-19 case, I mean, we've been trying. That's the best way to say we've been trying. There's been a lot of successes, but there's still a lot more to do. And issues as far as internet has been highlighted, and those are things that are reoccurring. If you don't have strong infrastructure, consistent access to energy, with what's the name? Internet, it affects a lot of things that you can do, especially once you start dealing with big data and then you have very horrible internet connection, it becomes a huge issue. So
yeah, I'll just kind of add to what both Ali and Darlington said. And I've worked quite a bit with both the Ghana Health Service and the Ministry of Health in Tanzania with data and data collection. And I think in both those places, as well as many other countries across sub-Saharan Africa, I think it's important to keep in mind that there needs to be kind of mixed methods of gathering data, and that often out at the kind of furthest reach facility level, things are gathered with paper. And even though there's often efforts to try to digitize it, those digitization efforts don't always eliminate the paper. And so I think it's important to have, use paper when paper is kind of the most appropriate, use digital when digital is the most appropriate, and then make sure that those two systems connect up together and work in concert with each other.
Yeah, I see. Those are very, very insightful comments. I can see that obviously the data can get corrupted somewhere along the chain, from from the field to the top decision makers, I can see potential for data corruptions. So it's very interesting that you mentioned that we actually need to have different type of data collection method, but the potential is still there. So I don't know if you have any methods. I'm sorry.
Oh, sorry. I just wanted to mention something there about data getting corrupted. I think we're responsible for corrupting some data as well, as digitizing doctors' handwritings has proven to be very challenging. So sometimes we have a hard time reading it and we just write blah. And then we assume that's what the doctor was trying to say. But yes, of course, we have a healthcare worker working at the time. Yeah.
Yes, and again, Diego, I think AI and data in general is to help us to gain clarity and to have evidence-based policies and measures, but it's not a way to have 100% certainty of anything. It's just to help us to make better decisions, to be more informed, and to adapt. But thinking that data and AI can provide for everything and that there is no risk, I think it's to asking too much of AI, and therefore to have the risk to be data driven instead of being impact driven. And that's where I think we have to accept that yes, data can be corrupted. Yes, we don't have access to everything, but it doesn't mean that we can't do better. And to have a mixed approach and really think, do we need that much data, and how much data we need, and how frequent do we need the data, and do both communities have enough time and enough resources to really focus on digitalization instead of focusing on providing healthcare, and how can we mitigate if they don't have the resources to try yet to embark them on the journey. I think that's where it's key now, and not trying to enhance the digital divide. On the contrary, to be very mindful of that, of those factors.
A very interesting comment. Now, as far as the leadership is concerned, because obviously after you gather the data, you gotta do something with it. Do you feel like it's easy to approach the leadership with data and ask them to make decisions based on the data, especially when it comes to gender-specific issues related to women health or education, you name it. Do you think it's easy to get the buy-in from leadership in many instances, or sometimes you have to fight your way to basically kind of like force the data on them to make decisions?
I can comment about Ghana. So very recently, again, I mean, this sort of situations are never black and white. They usually mix. In different contexts, it might be easy to get data to influence decision making or get key stakeholders to make decisions based on data, and others not so much. Some situations is a very transparent incident. So we had one recently, so about opening schools, and even lifting off the lockdown. When the government was asked that, hey, you are lifting lockdown, you're asking children to go back to school, that's a huge problem, don't you think? They said, no, we have the science. We've looked at the science, and the science says we can do this. And they did it, and now we have over 40,000 cases. And people said, okay, can you show us the science? Because there are a lot of us scientists also here who would like to see your science. Science is never done in a vacuum. Put your science out and let's respond. And they're like, don't worry, we have the science. So in that scenario, it was a definite no. They were not transparent enough. And in some sense, we could argue the decision was not really made on data. If it was made with very poor data. But then in other situations, we've seen government share the data and then be able to take responses based on that. We've changed even our approach to testing based on certain data. We are one of the few places that actually did pooled sample testing, and it was still based on just science and data. So in that sense, we've done a good job.
I would also add to that and say from where I am in Tanzania, it seems like leadership is very keen on using data-driven methods, and they are very open to data-driven approaches. It's the new fancy words that they are not big fans of: AI, artificial intelligence, machine learning. What is this? Especially now during election period, with the threat of eliminating jobs, you gotta stay away from those words. But generally, they're very interested in using data-driven approaches, or saying they use data-driven approaches, and user-centered design. So those are the keywords in case we're trying to get with decision makers. They love that. But yes, all very interested in doing that. Again, it's also hard to talk about COVID specific cases because technically we don't have any for the past X amount of time.
Yes, Diego, just a comment from the outside and also to relate that to gender. I think leadership is there globally, first of all, because investment is there and some big organizations financing humanitarian and development projects are pushing to have more informed decision and to really see the impact of their investment. So I think then it's a question whether you do have a stewardship, a vision, but also the resources, because sometimes you have to prioritize in your country. Do you invest in data or do you invest in infrastructure? Yeah, to have better infrastructure, sometimes you need data, but sometimes the urgency is so big in infrastructure and access to health or basic needs that some governments need to make a trade-off. And when it comes to gender, I think sometimes the willingness is there, but it's just that for women and girls in general, we should be better in providing the value of importance of women and girls in society. For example, the World Economic Forum back a year ago did say that by 2025, if all women from the informal economy were to be included in a more, I would say, frank economy, the net value for the global annual GDP would be increased by 28 trillion US dollars. So when you are able to put a price, I would say, or to put the economic, the economic value of girls and women on the table, then you demonstrate to leaders and to investors that there is a need and that both women, both girls are going to create more value and more worth to the community, to the economy of the country, and to the region. And then you are much more susceptible to have the decision makers to agree to have more disaggregated data and to link their digital policy to girls and women.
Yeah, appreciate your comment. Very insightful. Unfortunately, it looks like we're out of time because we were only allowed 50 minutes for this webinar. I really appreciate your participation. We have another webinar next week, Saturday, 5 p.m. GMT +1 on our website. It will be posted on our website, www.afaih.com. You're all invited to take a look at it next Saturday. Again, I really appreciate you being present for this webinar, and I look forward to a great weekend.
Thank you, darling.
Weekend.
Thank you, Diego. Have a nice weekend.
Thank you. Bye-bye.
Thank you,
Right.
Thank you.
Wait, how do I